So can you tell me about the most impactful parameter which can measure the actual impact of AI and robotics on patient outcomes in Indian healthcare?
So Indian healthcare is a different healthcare as compared to the global healthcare.
Yeah.
We are much more concerned about the cost of the treatment rather than the treatment itself.
All right.
And so whatever new technology we are using for the treatment of the patient, that should be cost effective.
All right.
Because until unless we do not make it cost effective, it cannot penetrate into all the urban and the rural areas of India.
Yeah.
And the parameter to assess it, any surgery, whether it is done by an open method or robotic or AI based, is about the success of the surgery. So the success of the surgery is the key parameter to assess the success of any robotic and AI program. And by using the robotics and the AI program, mainly the AI program, we can also provide some remote consultation to the rural areas. So AI in that way can penetrate into the rural areas rather than doctor going there. They can define an algorithm that at what stage that rural person who does not have a privilege of having the robotic or any advanced treatment should go to it for an advanced treatment. So that is the basic idea of effective way of using robotics and AI in a best way.
Perfect, sir. Well said. The government plans to add 10,000 new UG and PG medical seats in the coming year. How will this initiative help address the shortage of doctors in India?
So in India, the medical practice at this moment of time is more centralized. We have a very high-tech medical facilities available in cities called Delhi, Bangalore, Chennai, Hyderabad, Mumbai. But what is happening in a district called Bijnor or Darbhanga or Samastipur is very much limited. So by opening these number of seats, we are basically creating the doctors who can also go to those remote places and perform their own duties. At least the basic healthcare facilities need to be there, available at every district center, and then we can chart out a way of referral system. Say for example, a patient with a fever or a typhoid can be treated at the district hospital by any of the doctors available there. But if he develop a kidney stone, then he can go to a district bigger hospital. If he develops, say, a disease which needs a laparoscopic or a robotic intervention, that can be referred to the tertiary care center.
Okay.
But you need doctors. You cannot just run these services by GDAs or by Jhola Chap doctor. To replace all these Jhola type doctor, we need to have qualified UG and PG doctor who can facilitate that the treatment is available to the deepest of the corner of India.
All right, sir. So my next question to you is, as government aims to establish 200 daycare centers in district hospitals in 25-26, how will this initiative improve access to cancer for the undeserved and treatment in rural areas?
So cancer is something which is now not a dreadful disease. It is a disease which can be cured if diagnosed early. So these daycare center at the district level can facilitate, one, the diagnosis of a cancer, and second, the treatment of the cancer. And most of the time for the treatment of the cancer, you need a therapy which is required just for a day. So you're not required to be admitted for 3-4 days, which is right now happening. So even for one injection, the patient has to be in the hospital for 3-4 days. Now that basically wastes the human resources. That basically wastes the cost. So if we have a daycare center in which the patient walk in the morning, get the treatment done, and walk out in the evening, you can offer all type of treatment without wasting that human resources. So that I should say that this particular initiative can make a way to use the human resources in a much more optimized and a justified way.
Perfect.
And cancer as nowadays is not something which is a non-treatable disease. It's a treatable disease as any other disease is.
Okay.